What do heart disease, diabetes, prison, mental illness, obesity, cancer, and failed relationships all have in common? Stick around, the answer might surprise you. Welcome to the Managing Mental Health Podcast. Join us as we talk to leading psychologists about all areas of mental health, and we hear from real people who have overcome real struggles with mental illness and can now provide hope and encouragement for us all. I'm Jamie, social psychologist, author, and trauma recovery coach. Our question at the beginning, what do all those things have in common? Well, the answer is childhood trauma. In the 1980s and 1990s, Dr. Felitti was running an obesity clinic, and he noticed that a lot of women that lost weight and reached their goal all of a sudden relapsed and started putting back on a lot of weight. Once he dug into their histories, he found out that over 55% of them all had experienced childhood sexual assault. This led Drs. Anda and Felitti to design the Adverse Childhood Experience, or ACE study, to determine whether adverse experiences during childhood had a negative effect on physical health during adulthood. They surveyed over 17,000 adults who had health care coverage through Kaiser Permanente in California, and the results were mind-blowing and are still being studied today. Before we discuss the results, let's talk about what was on the survey. So they asked all these people, again, over 17,000, if they had experienced any of these 10 traumas during childhood. So what were they? Number 1, physical abuse. Number 2, sexual abuse. 3, emotional abuse. Physical neglect, emotional neglect, the divorce of parents or abandonment by one or both, violence towards the mother, a parent with mental illness, a parent with substance abuse, or a parent in prison. So on a scale of 0 to 10, each person ended up with an A score. Basically, if they experienced this, it was a yes. If not, no. The yeses were 1 point. So what they found out was that the greater risk for physical disease in adulthood increased with a higher ACE score. Nearly 2/3 of the 17,000 people from the study reported one or more ACEs. As the original study showed, physical and sexual abuse during childhood greatly increased one's risk for severe obesity in adulthood. Now, since then, many additional studies have found that childhood trauma increases obesity 2 times for females and 3 times for males. Well, what about other health risks? Nearly 25% of the U.S. population has experienced 3 to 4 ACEs. When there's a history of 4 or more ACEs, there's a 4 times greater risk of diabetes, STDs, heart disease, suicide, addiction, and cancer. Studies have consistently shown the link between childhood trauma and disease in adulthood. When a person has an ACE score of 6 or higher, you're not going to believe this. If a person has an ACE score of 6 or higher, they have a 20-year lower life expectancy. Wow. That's just it's unbelievable. Unbelievable. So what about other areas of life, like, let's say, mental illness? These adverse childhood experiences, again, ACEs, can disrupt brain development. After stress response systems rewire the nervous system, they also hijack hormonal production and increase the risk of developing various mental health conditions like depression, anxiety, PTSD, substance use disorders, and suicide. The trauma actually changes the physical development of the brain during childhood. It rewires synapses and neurons in the brain. It causes the hormones and neurotransmitters in the body to get stuck, either in underproduction or overproduction. And this continues into adulthood. It doesn't just go away. 8 out of the top 10 reasons that people seek therapy can be directly tied to childhood trauma. Think about that. 8 out of the top 10 reasons that people seek therapy from childhood trauma. Okay, what about social issues? And this is one that we know about. I just don't think we do enough about it. We don't apply it as much, I guess. One nationwide study found that 60 to 80% of men in prison had an ACE score of 4 to 6. 60 to 80% of people in prison. That's the majority by a huge number. And they have this ACE score of 4 to 6. ACEs lead to lower education, higher unemployment, higher homelessness, higher poverty rates, and have an intergenerational impact. Think about that. So one of the ACEs was if your parent had a mental illness. So if a parent has an untreated mental illness, and then it's having an effect on the child. So that right there is intergenerational. Another one was, what if a parent was in prison? That itself is a emotional trauma for the child. So we can see how these things get passed on from one generation to the next, at least the effects of these things. ACEs also lead to increased difficulties for healthy romantic relationships, sometimes for life. I can tell you one of the areas I've studied is attachment theory. And it says that basically if a person has an unhealthy attachment with their caregiver during early childhood, then it causes them to have unhealthy attachments in adulthood with romantic relationships. You may have heard of avoidant or anxious attachment styles. That's where that comes from. So ACEs directly ties into people's success or failure with healthy and unhealthy romantic relationships into adulthood, dating, marriage. So, if you're finding this interesting and you want to hear more content like this, please like, subscribe, and share with others. What can we learn from this information? So first, we need to do a better job understanding physical diseases. Instead of just looking for a physical cause or a physical cure, we should also be looking at the emotional or mental cause and cure. We should be asking about the ACE survey when doctors are noticing symptoms of serious illness. This survey can help provide mental and emotional healing that will also impact physical healing. There's absolutely a gut-brain connection, and many studies show that improving diet helps mental health symptoms, which in turn helps the nervous system and other systems within the body. In other words, we need to use more of a holistic effect in our treatments, not just prescribe a pill to treat the physical symptoms. We can actually lower symptoms by treating mental health and vice versa. Secondly, if we want to be healthier as individuals and as a society, we need to reduce childhood trauma and or work to build resilience and healing early, very early. The earlier, the better. Homelessness, poverty, food scarcity, parental relationships. We need to keep working on how to improve these issues as a society. You can do this with yourself. You can do this with your family. We all can. And then we can take that into a larger perspective. Providing healing for adults that have higher ACEs scores so that they can be more effective caregivers for their children is extremely important. We can do things like provide parenting classes and teach parents how to teach their children resilience. Thirdly, criminal justice reform. Many of the methods and systems we have in place are acting just as a revolving door. They actually create more harm than good in some cases. There's very little reform, only punitive so-called justice. Our education system has slowly begun to adopt trauma-informed methodology. When will the criminal justice system catch up? All human service professionals should be trauma-informed when creating or managing programs because all of them are affected by the results of childhood trauma. So these are just a few of things that we can learn from the ACE study. Hopefully some of the physical, emotional, cognitive, relational, and social dysfunction we see every day can be considered through a different lens. Maybe we can look at things from a different perspective. So, were these results surprising to you? Did you know all these things were negatively impacted by childhood trauma and in such a strong way? Comment below. Let me know what questions you have about ACEs, the ACE study, or about childhood trauma. Let me also know what other aspects of society you think could be positively affected if we adopt more of a trauma-informed lens or perspective. Be sure to check out future shows where we'll discuss important information about mental health issues, including causes, effects, treatments, personal journeys, and encouragement. Until next time, let your barriers become your bridge.